Vaccines are one of the most important things I do as a pediatrician. And even in my own career, I've been practicing pediatrics for 20 years, and I've seen huge changes in the illnesses that I see in the office, in the number of children that I hospitalize, in the number of children who I have to do blood tests on, and spinal taps and urine tests because I'm worried about a serious infection. And that's directly related to the immunizations that we use. Pediatricians who are a few years older than I am, who've been practicing for a little bit longer, have stories to tell about meningitis and measles and whooping cough that I never want to live through. And I have my own stories about kids with meningitis and having to do spinal taps and blood tests on babies that I just don't have to do anymore because we have these immunizations to protect them. Immunizations are one of the most important public health advances that we have in this century and probably for centuries before that, because we can prevent diseases. We can keep kids from getting these illnesses and spreading them in the community. Vaccines save lives, and we know that vaccines are safe and effective. There certainly have been many concerns raised over the past 20 years especially about vaccines, and I think that all of those concerns need to be taken seriously and investigated, and one after another they have been. We've looked at all of the proposed issues with vaccines, and we continue to monitor vaccines for safety. But vaccines are safe and effective. And as a pediatrician, that's one of the ways that I keep our community safe, is by making sure that kids are up to date on their vaccines, by encouraging parents to get their kids in for their vaccinations, by giving them good, reliable information about vaccines and the potential side effects as well as the safety and the information that we have, the evidence that we've accumulated about how safe and effective vaccines are.